Hey all, today's day 2 of the series, and today, this morning I did some marking, and then I typically don't do marking on Tuesdays, but because it's the end of the term and I'm helping out with a first year psychology class, then we need to wrap up the course. And then now this afternoon, I'm running off to the York University Psychology Clinic. Now, as some of you may know, I'm training as a neuropsychologist, but also as a clinical psychologist. And yesterday was my neuro day, which is more brain and behavior, and then today is more clinical psych. So I'll be doing more therapy with clients. The clients I see have a variety of different backgrounds. Some of them, typically it's anxiety or depression, as a lot of people deal with that. But at the clinic, we've seen a variety of things. I've worked with a variety of patients. PTSD has been some of my clients' backgrounds, or schizophrenia, or agoraphobia, which is like, it's typically they don't like to leave their house or things like that. So, a variety of conditions and level of debilitation based off of their backgrounds. So today I'll also, in addition to seeing the patients, I'll be doing supervision with my psychologist supervisors, and they'll help me integrate different types of modalities into my therapy. So many of you probably know of cognitive-based behavioral therapy, but there isn't just one type of therapy. I've also learned motion-focused therapy and client-centered therapy, and I do all of those at the clinic with my patients. So that's kind of my day-to-day. To answer one question from yesterday, so right now I'm working in the epilepsy clinic doing neuropsychology assessments, but I've also previously worked in the Parkinson's clinic, and I also have worked in a diagnostic clinic at Sunnybrook, and so there I see different types of patients every single day. One day will be a patient with MS, one day will be a patient with Alzheimer's disease, and so there I'll help patients determine their strengths and their weaknesses. Typically their weaknesses are due to their disease that is affecting their brain. And then I'll also help with diagnosis. So sometimes patients come into the clinic, they'll see a neurologist, and they'll be complaining of different effects on their cognition. So they're slow, or they can't remember things like that. And I'll help the neurologist with a differential diagnosis. So figuring out, do they have Alzheimer's disease, or do they just have depression? And helping with some of the recommendations from that. Okay, so off we go. Day 2.